Hey everyone. So, over the past few weeks, I've noticed that the pain that I normally get in my legs and my arms is gradually getting worse. I never really had that bad of pain in my arms before, and now I'm finding mid afternoon, even if I've been home all day, I start getting severe pain in my arms and also in my legs. Now, the problem I feel like I'm having is distinguishing if it's a nerve pain or if it's something else. I've always dealt with nerve pain in my legs, but it usually doesn't happen until I'm ready to go to bed and my body is resting that I feel it. But this pain that I've been getting mostly in my arms seems to be happening anytime throughout the day. And the issue that I'm having is, as I've said before, my doctor gave me a prescription for a drug called Aventil, which is supposed to help with the nerve pain. So I was going to take it the other night, and to be honest, I got scared and I couldn't take it. And the reason for that is because I've heard, read about so many stories about how these drugs that are for nerve pain can have some really serious side effects. And I'm really, really nervous to start taking it. But there's some days where the pain in my arms is just so excruciating, I really have thought about it. I probably should give it a try, but again, I'm actually really nervous to try it. And when I've reached out to others who have MS to ask if they have used it for their pain, actually a lot of people haven't even heard of this drug, Aventil. So that makes me a little bit more nervous. It's probably something I should talk to my family doctor about the next time I see her. She was the one that prescribed this, so I really need to talk to her about it, let her know my fears, and find out if there are any serious symptoms that I could expect while taking this medication. And I know you've heard me say before that you always have to be really careful with taking medication. As I've talked about, I've suffered from really bad heartburn in the past, and recently I ran out of the drug that I was taking called pantoprazole for my heartburn, and it seemed to be the only thing that worked. I did have an ulcer, but that did heal. So I ran out. I've had no problems with heartburn for months now, which is great since I've been on this medication. And so I thought, okay, well, I'll just go back to taking my Zantac 150 twice a day. So it was 2 days now without the other drug, pantoprazole, I was on. And this morning I started getting terrible, terrible heartburn. So I know that I need to keep taking that medication. The only issue I have with that is it's one of those drugs that they call a PPI, which actually prevents the acid from developing and going up your esophagus. And from what I know about these type of medications, you are not supposed to take them long term, just as well as something like Nexium. It's supposed to be taken in a short period of time to help with that and heal an ulcer, but not an extended period of time. So now that I know that this drug is really the only thing that is helping with that, I need to talk with my doctor about that as well and find out if it really is okay for me to keep going on it, because it really seems to be the only thing that works, and when I'm stopping it, my heartburn's coming right back. So I'll keep everybody kind of posted on that. I think the really hot weather is having a big effect on the pain that I'm getting in my arms also. That's kind of just something that I also need to wait to see my specialist about and let him know that as well. So as I've said before, whenever you are taking a new medication, make sure you ask the right questions to your doctor. Make sure it's not going to interact with anything else that you take. And I just think that's a really important thing for any medication that you're on. So I hope everybody enjoys the weekend. Try and stay cool in this very hot weather, and I will see everybody next week.